What's going on, Slatards? Gotta keep it down because the wife is sleeping. Tonight, I want to talk about 3 easy things you can do to fix our healthcare system now, right? And the first one would be to incentivize cash prices at or below Social Security prices, right? What the government pays the providers in Social Security. Direct payments of cash, let's, make it as low as you can, but it's got to be under what we pay you, right? Like providers, we can decide how much to pay providers. To tell you the truth, I think most providers, they just want to focus on patients, right? They don't really want to deal with insurance paperwork and claims and all that other stuff. So, you pay your doctors and you pay your providers well, but cash prices are going to be reasonable, right? And you can't overcharge people more than you charge the government for older people, right? So you do that right away. Costs will come down right away. Right away, you give tax incentives for cash payments for services lower than what Social Security pays, right? So then, second of all, you make all medical expenses tax deductible, right? Any dollar that you spend on your health or sickness is not income. It's tax deductible. Every bit of it, right? You do that. You make all medical expenses tax deductible and you incentivize the lowest possible cash price for healthcare, right? And then the third thing you do is going to be a little bit harder. It's a little bit harder. All the other countries do it already. India, China, United Kingdom, right? The government tells the pharmaceutical companies what they're going to charge the people for their drugs, right? There's no I don't think any really negotiations, right? The government says this is what we're going to pay and this is what you're going to sell it to. And if you don't, we'll nationalize you, right? We'll nationalize you. We'll call you critical, right? The American citizen system has kind of the same thing, right? We fund all these pharmaceutical companies with the NIH, but then we don't get cheaper drugs on the back end, right? When they develop something cool, they're robbing people, right? And that's the system we have today because no part of our pharmaceutical industry is nationalized, right? None of it's nationalized except for maybe partially, what we'll pay for Social Security for drugs, right? Like that's a start. That's a start, right? But I think you go farther than that. I think you negotiate as a nation a fair price for healing drugs for your citizens. And if the company doesn't want to play ball, you nationalize them. And it won't take too many being nationalized before all of them will fall in line with the pricing, right? Like the government of the United States needs a research arm of its own. We'll just take these, major research labs and companies over and nationalize them, go to all their doctors and go to all their scientists and say, work for the people of America. You don't have to worry about anything but, healing America. And we're going to pay you well, by the way, too, right? And you won't have to do any more paperwork, no more insurance claims, right? You just deal with that like that, right? You put the fear of a nation on these pharmaceutical companies like we're coming after them because we would be. Like I think you got to pay private companies enough where it's worth their while, to do this. But I think you also have to compete with your own government arm research, pharmaceutical research arm, right? Like, I think You should have an entity that's only concerned with solving health problems for the citizens of this country. That's an only concern, right? Not profits, not corporate profits, not how safe the drug is, all those things. You have to be able to compete against something. So I think negotiating low prices for the American people for pharmaceuticals, and if the company doesn't play, nationalize them is the play. I really do. I think those three things would solve America's health crisis. Low cash payments for services, tax deductible medical services, and pharmaceuticals that are affordable. Peace.